I'm pleased to speak about our multi-center phase 3 trial GMMG HD7, which is a two-part trial, which included more than 660 patients. And in part one of the trial, we compared isatuximab induction in combination with lenalidomide, bortezomib, and dexamethasone to lenalidomide, bortezomib, and dexamethasone alone. Induction therapy duration was 18 weeks, and thereafter patients could receive or received a high-dose melphalan therapy followed by autologous blood stem cell transplantation. And if patients had less than a complete response or high-risk disease, they could opt for a tandem transplant. The trial then went on with a second part where we randomized patients to maintenance strategy, either with the standard of care lenalidomide or lenalidomide plus isatuximab for up to 3 years. So the trial has two independent primary endpoints. The first primary endpoint was MRD negativity rates after induction therapy, and that has already been published in 2022. And at the current data cutoff, we will report on the progression-free survival from this first randomization. And the second primary endpoint of the trial is progression-free survival from the start of maintenance therapy, comparing the two maintenance strategies, and we will report on this when data are mature. So at the current data cutoff, we looked at two important new findings. So first, we saw that the rates of MRD negativity in both arms increased post-transplant, with a greater increase in the patients that received isatuximab-RVd as induction therapy, with approximately 70% of the patients achieving MRD negativity in the bone marrow post-transplant, as compared to 48% of the patients achieving MRD negativity in the RVd group. The second and most important outcome is the progression-free survival from first randomization. At a median follow-up of 48 months from first randomization, isatuximab-RVd as compared to RVd induction therapy reduced the risk of progression or death by 30%, which is clinically significant and meaningful. And we observed that this was also the case in most clinically relevant predefined subgroups and on a multivariable analysis and on a sensitivity analysis where we waited for the second randomization. I think these results are highly significant for clinical practice and our patients, since they show that a quadruplet regimen consisting of isatuximab, bortezomib, lenalidomide, and dexamethasone leads to a prolonged progression-free survival, even after only 18 weeks of induction therapy. And this prolongation of PFS was independent on the second randomization, where patients received either lenalidomide or lenalidomide and isatuximab. And it was also achieved without an additional consolidation treatment post-transplantation. So I think these results really underscore that quadruplet induction therapy is the standard of care in patients with newly diagnosed multiple myeloma who are eligible for an autologous stem cell transplantation.